Hello again, my name's David Holden. I'm the MC and creator of the Holistic Cancer Congresses, and today I'm going to be interviewing Dr. Nicky Baillie, who's an integrative doctor who also is a registered medical herbalist and is also trained in Hakomi mind-body medicine. So Nicky, welcome.
Thank you.
Really looking forward to your talk. For the audience behind the camera, maybe you could just share a little bit about how you practice Western medicine combined with herbalism and your interest in Hakomi, please.
Sure. So I originally trained in Western medicine and became a little frustrated with the limitations of Western medicine, really seeing the benefits it could offer,
Sure.
but also feeling like there was more to a lot of people's health issues. So soon after graduation I trained in herbal medicine and started incorporating that into my practice, and I found people were really, often quite interested in looking at that as an option. I also did some study in nutritional medicine, and started incorporating that into my practice as well. So it was really about offering people more choices and the opportunity to look below the surface and see what might be contributing to their health issue or illness.
So you're looking at symptoms and causes as well?
Yeah, that's right. Yeah.
Excellent. And can you share with the audience a bit about what Hakomi is and how you use that in your practice?
So Hakomi is a form of mind-body medicine, and it's really a way of studying ourselves and finding out what might be limiting us or blocking us from reaching our full potential, looking at those patterns that can repeat over and over in our lives that can become a bit frustrating after a while. So it's really a way of studying our experience with some guidance and assistance. So
many of the audience will be oncologists, conventional medical doctors who are using chemotherapy, radiotherapy, surgery in cancer cases. You see quite a few cancer patients. I know you do a lot of work with cancer. Can you explain how your approach is perhaps somewhat different to theirs in treating cancer and helping prevent it as well, of course?
Sure. So many people I see are starting off their journey with cancer and going through conventional treatments. And the message I get from many of them is they feel quite helpless and powerless in that process. They feel overwhelmed, they feel confused, and many of them are looking for what else they can do to support themselves through some of those conventional treatments. So how I often work with people is really talking to them about what else they might be able to do while they're having chemotherapy, radiotherapy, surgery, helping them navigate that journey, supporting the family who often have a pretty challenging time as well.
Absolutely, yeah.
And then once they're through some of those conventional treatments, looking at how they can optimise their health and maintain their health as much as they can long term. So you're helping reduce side effects as well of conventional therapies and perhaps making it more comfortable for patients who are undergoing conventional therapies as well? Yeah, that's right. As many of the listeners will know, conventional cancer therapies can really knock people around. And in my experience, there's a lot that can be done to really ease that journey, reduce side effects, reduce hospital visits during treatment, and really optimise the outcomes.
So like reducing the burden on the hospital system to some degree, making the journey a lot more comfortable for both the patient and their family. So it's a very integrated approach.
That's right.
Wonderful. So specifically, what are you planning on talking about at the 2013 Congress in Auckland here coming up in March?
So what I'm planning to talk about is what I've titled Integrative Cancer Care, so really supporting people through conventional cancer treatments. So focusing on that part of their journey and what can be done to help them through that time. And I'm going to be looking at the evidence behind some of the things I'll be talking about. And there is quite a lot of research in this area.
Excellent.
And also some of the traditional approaches that can help with some of the symptoms people suffer through conventional cancer treatment.
Because as a scientist myself, the scientific evidence base is really important to bring that out into the open, because I know a lot of criticism has been made about certain integrative approaches, saying there's not enough research, but I've found lots of it. There seems to be, I'm not sure what journals these people are reading, but there seems to be an abundance of scientific information from what I've read.
Yeah, there's a real growing body of evidence for many of these complementary treatments. And much more is needed, but I'll be presenting what is available, where it's available, and also some approaches from traditional practices and from my experience, which I found helpful.
Great, excellent. So how long have you been treating cancer in this way at the centres that you work in?
Well, I've been working with people with cancer more holistically for about, I would say, 14 years now.
Great, so you've got a lot of experience there.
Yeah, I have, yeah.
Right.
It's an area that I'm really interested in and I guess specialised in to some degree. So I do see a lot of people with cancer who are wanting more integrative approaches.
Right. So I think yours will be very complementary with Ian Gawler's approach, which is very much into mindfulness, meditation, and that really bringing in the family and the whānau into the equation is a big part of what he does. Yeah.
I think addressing all of those levels, the physical, mental, emotional, spiritual, are all really really important to optimise people's journey and their outcomes.
Excellent. Thank you very much, Nicholas. So we're really looking forward to Nicholas' talk. So if you want to know more about what else is on, have a look at the other DVD clips on this website. You can still get in the last few days of the special $100 off the registration fee of $4.95. So have a look on the website, click on the buttons, and really looking forward to your talk, Nicholas. Thank you very much.
Thank you.
Look forward to seeing you.